Okay, so it's 1 o'clock and we'll call the meeting to order. I'll ask if there's any disclosures of interest of members of the committee. None noted. Are there any additions to the agenda, Marlene, other than what's listed here?
Nothing this afternoon, thank you.
Okay. And I should note that the roll call finds everyone in attendance except for Councillor Huffman, who's away from this meeting. The adoption of the minutes from the June 18th meeting on page 3. Marlene, was there any updates from those minutes or anything you want to comment on?
Just to let committee know that everything was passed at council and committee on Tuesday evening, and it'll be ratified next Tuesday for approval of all the reports from last advisory on the 18th.
Okay. Then we'll move right into staff reports. Marlene, do you have anything you want to bring forward at this time?
Through the chair, I do not at this time. I'll
Okay.
respectfully turn it over to Dr. Nasathuri for his update.
Okay. Shanker, go ahead.
So thank you for allowing me to speak today, members of the committee. First and foremost, one of the things I'd like to share with you is that our understanding of COVID-19 is evolving over these past 6 months. It's a new disease, and items that seemed clear and defined are now subject to review and some level of introspection. And that is the nature of practicing medicine, and it's particularly new related to any disease, be that when HIV became first apparent, or SARS, or now we're dealing with COVID-19. I've been asked to comment about the use of masks as one strategy related to reducing the transmission of COVID-19. And I'd like to share a few comments about this. First and foremost, the Public Health Service is apolitical. We tried not to get involved in the political matters, but stick to what we think are the public health approaches and initiatives. The question I would always ask is, how can we reduce the transmission of COVID-19? That's really the fundamental clinical question. And that's in keeping with the goal of how do we keep people safe and how do we minimize the burden of disease throughout our community. So when I think of our approaches to managing COVID-19, that includes some of the things that we've been advocating from the very beginning, which is to identify individuals at risk, test them, effectuate self-isolation plans. I think my most recent estimates suggest that there were thousands of people who serve self-isolation plans. At the current time, there are, since the beginning of the pandemic, there are 445 cases of COVID-19. So our first goal is to isolate, test, and identify individuals. The other thing I think that's particularly important is to continue to focus on high-risk high-risk environments, and those are in our health district, based on the information that we have up to this point, are congregate settings. That includes nursing homes, retirement homes, bunkhouses of agricultural workers, schools, childcare centers. And I do think that one of the new challenges we're going to be facing is childcare centers and schools and people that might be infected with COVID-19 in those settings. Thirdly, I think social distancing. That's an important part of our management plan, and I do think there are still opportunities for improved social distancing. Hand washing, washing your hands, preventing transmission through hand washing is also probably an incremental step. And wearing masks. And wearing masks is one additional incremental step to managing COVID-19. So I've said this many times before. I strongly recommend people wear masks when they cannot effectuate social distancing. I think it's a good public health intervention. The one thing I want to share about masks, and this is one of the, is that there are really two groups of masks. There are homemade masks, the ones that are made by individuals or made commercially, and then there are medical masks. And medical masks are what we might use at the hospital in a healthcare setting. The question of masking at this current time is about masks that are typically, but not always, made by people. And those masks have certain challenges. Among them, they need to be cleaned, they need to be applied properly, We have to really work to educate people to avoid touching the masks. And those masks are primarily beneficial for preventing a person who might have COVID-19 from transmitting it to somebody else. That's the real advantage of those masks. It is true that it may have some effect on people who have COVID-19 and cough and prevent the person who's receiving those droplets, but the real primary benefit is on the source control, as we would call it. So anytime we have to evaluate the efficacy of a public health program, we have to think about background risk. That is, the number of people who are currently infected with COVID-19. If everyone, or if 90% of the people were infected with COVID-19, then source control has real merit. If no one is infected with COVID-19 in the health district, then it has less merit. So in making any policy decision, one has to consider how many people who are currently infected in the health district. And the next thing is adherence. Will people actually go for it? Will people actually decide to wear the masks and go along with that plan? Third is acceptability. And that is a difficult construct sometimes to comment on. There's the acceptability related to, can it cause skin irritation? Some people are claustrophobic. Some people get short of breath when they wear a mask. Children cannot wear masks. Very small children would be hard to wear masks. People that have cognitive impairment or suffer from dementia, they would be challenged to wear masks. The issue of comfort. In a hot day, it might be not comfortable for everybody. And then there are objections that are based on philosophical constructs, where some people feel that they should not be directed to do something, even if they feel that it has merit. They don't feel there should be direction towards that. Those are all considerations, I think, when prescribing any policy related to public health. So whenever we effectuate a public health program, the things we start with are information, education, dialogue, rule, and regulation and law. And that's sort of the pyramid that we would move forward with. I think the question at hand is, and this is, I think, something for council to debate, is should we make the wearing of masks a mandatory or non-mandatory item? And if asked, I'm happy to comment on that. But I would say that we at the Public Health Service would this is a policy that affects every single person in the health district, and I think it's a valuable thing for elected officials and for councils to have a dialogue and debate about. I'm happy to speak more to the science of wearing masks and the policy issues and answer any questions that members of the committee may have. Thank you.
Thank you, Shanker. Any questions to Dr. Nessathurai? Councillor Corbett.
Oh, there we are. Another bit of technology. I have to ask, a lot of people are influenced by people south of the border from us, and they indicate that coronavirus 19 or COVID-19 is a hoax. What's your comment on that?
It's clearly not a hoax. There are 444, at least in our own health district, I'm looking at the numbers, there are 445 people who've been diagnosed with COVID-19. There are 32 people who died. As a doctor, I have managed and reviewed the files on a number of people with COVID-19. I think the disease is real. To characterize it as a hoax, I think, is inaccurate at a minimum.
Thank you, and I believe that we got into the discussion of masks and the idea of wearing them everywhere, and I certainly believe that social distancing and washing hands, and where you can't social distance, you should be wearing a mask. we've got into the request to find out what our business people think about it, and I'm getting a lot of negative comments in terms of wearing the mask because it affects them, and they're down 25% on business, and they want to continue within reason. Are you saying it's a political decision whether to wear a mask or not? Is there, at some point, you may indicate that it's imperative that you do so to make a ruling on it?
Sure. So for the past 18 months, I've tried to stay out of the political fray, but I guess I'm drafted today. Look, I think that from a public health point of view, people wearing a mask is a good thing, especially when they cannot socially distance from other people. So if I went to Walmart or I went to a retail establishment or I went to get my hair cut, I would wear a mask. I think that's the right thing to do.
You're not going to mandate it?
I'm not, as of today, I'm not going to mandate it. Let me give you the reasons why. If we have thousands of cases of COVID-19 in the health district, that changes things. Right now, we have a handful of people who have COVID-19 in the district.
Farah, thank you very much. Talk about moving into stage 3, and I understand we are probably a week lag from going on. Do you see us moving into that stage 3 next week?
So if I could just finish my last response, Mr. Corbett, and then I'll answer that. If that's
Sorry for
okay.
interrupting you.
Look, I think that we should not remove the option to the public and to the community to make masks mandatory. If you had to ask me my recommendation today, I would say this. I would say that we are in the middle of July. As a public health measure, what we should do is to at least spend the next month before the next Board of Health meeting or the next council meeting and work on some component of education. Because our goal is not to mandate things. Our goal in the public health service is to get people to a better place, to manage public health better. And that would include getting some baseline assessment of current mass use, which we can do. It would mean additional dialogue with the people that are affected by it, which are business owners in part, and other broader constituency in the community. Think of ways that we can educate people on how to use a mask, because it's just not getting a mask, but it's actually using it in a proper way. And it is about building some level of consensus in the community. And I think that when you get to that point in September, we can then make a decision, and council can discuss that, and Board of Health can discuss that, and say what is the right framework for asking people or mandating them or requiring them to wear masks. And they are balancing many important policy interests, which are all legitimate. You know, I don't think we have to discount the legitimacy of the people who support masks and those people who oppose them. In the interim, so that's what I would suggest, and I would ask Ms. Miranda to help us to effectuate that, is to put some sort of education and dialogue so that in September we can discuss this more fulsomely. We're not always obligated to follow what the next health district does, because we have our own, and that's why we have 34 autonomous health districts. But we can make plans that are relevant to our health district. So that would be my recommendation. I know it's not a black and white answer. Nothing in public health really is. But I think that for now, I think that we would like to at least engage in some level of public health intervention that's short of a mandate. And if the mandate, if that intervention is not successful, then we can reflect back on it. And I think we'd have a broader consensus for moving forward with the mandate in September, if that's what council chooses. So sorry for that long-winded answer, Mr. Corbett, but that would be my thought today.
Thank you. Further on the masks, they say that masks are a hoax. Is that right?
Yeah, no, we know in medicine if COVID-19 is transmitted primarily about people transmitting respiratory droplets, and those respiratory droplets can travel up to 6 feet. Wearing a mask will prevent the transmission of those droplets. So I I'm always reticent to use the word hoax, but I think that perspective really is not consistent with what reasonable science would say.
Thank you. Moving into stage 3, weak lag with the other municipalities. Do you see us moving into that stage next week?
I've really earned my salary with Mr. Corbett today, so do you have any more questions of me? I'm teasing you, Mr. Corbett. Those are good questions. I think that I was on a conference call with officials at the Ministry of Health last week. I think the decision is the government's, the provincial government's, and not my decision, and it's the provincial government's decision. It's informed by a number of factors, including the epidemiology, and one of the questions that they had wanted to follow was, is there a 4-week time period between from going from stage 1 to stage 2, and then from stage 2 to stage 3? From my perspective, the criterion that has been promulgated by the province, things like, what does the epidemiological data show? Well, we've had relatively few cases since the outbreak at the farm, which is resolved. So I think that the epidemiological data suggests a positive signal. What is our ability to trace contacts? Meaning if somebody got sick, would we be able to identify the people they interacted with? And I think our capacity on that is pretty good. Hospital capacity. Now, I was fortunate to speak to the medical director of the hospital last week. I think, assuming that trend is the same, I think we have sufficient hospital capacity and testing capacity. At the current time, we have testing capacity, and I have a meeting this afternoon to just continue to advocate for sufficient testing capacity. So if by those 4 criterion, I would say that yes, we are ready to move forward to stage 3 or that next level. But the ultimate decision is the provinces and cabinets and not mine to make. But I'm optimistic that we will move forward.
Another one of those political decisions, eh?
Right. That is one reason why I don't have to run for re-election, thankfully.
And thank you. One last question. They speak of a second wave or outbreak coming in the fall flu season. Do you see that applying to our area as well?
Yeah, it's hard to predict the future, but I am very concerned that, as doctors, we're always cautious, right, especially about the future. I am very concerned that a couple of things that we have to be concerned about. One is that will we get a resurgence of cases as we move forward with this relaxation? And it seems like that is at least one component of what's happened in the United States. That you're seeing resurgence of cases. And in the United States, I have a graph here, and I'm happy to share it with you. The United States, I think they have more cases now than they had at the beginning of the pandemic on a daily basis. So that's one issue. The second is, I wonder, will this be like the annual flu season, that we'll have another COVID season, a new strain of COVID, and will we be down this road again in the fall or at Christmas time? So those two items are of great concern to me.
I have Councillor Taylor, then Councillor Patterson.
What I've got to say right now is I'm very impressed with Councillor Corbett's onslaught of questions, because he basically covered everything I was going to ask. But maybe just to reiterate, at this point, based off of the number of community cases we have, you don't see the need to mandate masks. An education piece is more effective, and come back to the discussion in September, just to reiterate.
Yeah, I guess I think that there's a clear role for wearing masks, and I would encourage all people to wear masks, especially when they cannot socially distance. That includes going to the service provider, physicians' offices. When I'm restarting my clinic next week, and people wear masks, so that's our policy. I think that if we had to make, it is for council and for the elected officials to make these political decisions, but since I've been asked to comment on it, I would say that at this point, before one makes it mandatory, that we engage in a fulsome campaign to get adherence. Even if we made it mandatory, we'd still have to educate people and win their compliance. If I could share with you, and this is a challenge in public health overall, there are many things that are prohibited that still happen. People still use illicit substances despite the fact there's prohibition against them. So we try to act without judgment, and I think if our goal is ultimately to get adherence, then we have to think of a fulsome campaign to get adherence. There are always going to be people who wear masks because they think it's the right thing to do. Those people don't need a mandate. There are some people who never wear a mask, no matter what the direction is. And then there are a group of people in the middle who, once they acknowledge that there has been some fulsome debate and dialogue and there's legitimacy if a mandate comes about, might shift towards that. It's like speed limits. That people ultimately say, well, I don't agree with something, but I'm willing to do it because at least there's been some dialogue and discussion about it. So I would not discount in any way that masks are important. They're clearly important. I encourage people to do it. I think, though, that before we made it a mandate, I would recommend that we at least try other things and also get some baseline data to understand, where are we at in this health district related to mask usage, and then we'll know how effective it's been after our education campaign.
I actually thought of one here, and thank you for that. Thanks. Of the places that are making masks mandatory, I've read of a few places that are exempt, such as gymnasiums, places of exercise, those sorts of things. Are there, if we were to go that route of making it mandatory mask wearing, what would that list look like that you would suggest of places that would be exempt from that rule?
Yeah, I'd start with and maybe I can refine my answer at the next Board of Health meeting, but I would always start with the presumption that there should be a reason why you cannot wear the mask, right? So if you're in an athletic facility, I think that running on a treadmill with a mask, I think, would be really not successful. Obviously, if you're engaged in any activity that causes the mask to get wet, that would be problematic. But I would try to use a policy and in any public health policy, make it simple, make it easily understandable, make it rational, and try to get people to buy into it intuitively. And if we can achieve those goals, I think that's the way I would try to formulate policy on this. I have reviewed many of the different bylaws, and they have some nuances. Like some, I think, were say at children under 2, no mask. Others say children under 5, no mask. Some say children under 2, no mask, but between 5 and 2, if the child is willing to go along with it or child's willing to accept that. So I do think that we're going to have some level of nuance, but if people are going to wear a mask, we should try to make the exceptions narrow and rational.
Councillor Patterson.
Thank you. Just to follow up, it's kind of been said before, but I guess want to be a little bit more direct. As a representative of Haldimand, this is an advisory board, which I'm hopeful shortly in the near future that after discussions with the province that maybe we have a bit more structure and a bit more meat in the game per se as far as input. That being said, you've started the basic discussions, and I'm really, really hopeful that any kind of dialogue happens at a Board of Health meeting prior to going to a council meeting. And the reason I say that is I watched the meeting earlier this week in this chamber where a member wanted to expedite the process and wanted to be discussing a bylaw. I believe it's coming to probably Norfolk Council next week. I really, really think it's imperative that the discussion happens with people such as yourself, Marlene, and the other medical experts. You started in your statement, I think you say basically every time you talk, public health is apolitical, and that's what it should be. I don't want to see us run into the curve south of the border where the split is a political decision to wear a mask or not. So I'm hopeful that before any rash decisions is made by Norfolk, who has the wheels of the Board of Health as far as Haldimand Norfolk, has that frank dialogue and input from you folks.
Yeah, clearly, any public health intervention of this nature requires the support of it requires the support of the people. And no, I think that's a fair perspective. I think that the people of Haldeman County, who this will affect, should have their voices heard as well.
Okay, I see no other hands, so Shankar, thanks very much for the update. I appreciate the information, and I certainly appreciate everything you've done, you and Marlene and the rest of the staff over the last 3 or 4 months. I can personally vouch for the fact I've had several emails from people in the Haldeman area who have had different discussions with yourself and other members of staff, and they were very complimentary and impressed by how quickly you folks responded and the knowledge and information you were able to share with them. So I want to thank all of you for what you've done. I know you have to run to another meeting, so I'll let you go.
Thank you so much.
Story of your life, right?
And the staff would be, I think, very appreciative of those comments, so thank you.
Thanks. Okay, so we'll move on to item 6.3, which is the shareholders agreement update. And Heidi, I assume the floor is yours.
Yes, thank you, Mr. Chair. Through you to members of committee. First of all, I'd like to thank Matt Bowen, the CEO of the Haldeman Norfolk Housing Corporation, for joining us today. Matt and I have worked together on the presentation that we're going to give to you this afternoon on social housing regeneration, and we're both really excited to have the opportunity to have these discussions. Before we go into the presentation, I will give a verbal update on the status of the shareholders agreement for the Haldeman Norfolk Housing Corporation. So after the joint shareholders meeting last fall, staff in both counties and the Haldeman Norfolk Housing Corporation began working on a draft shareholders agreement. Norfolk, our department, took the lead on submitting that to external legal counsel for their review, and then the development of the agreement got paused because of COVID, because people were, including myself, were redirected to the community's emergency response. But we have gotten back to work on that. It's been reviewed by senior staff at both counties and is at a legal review right now. Once that is completed, then it will be submitted to the Board of Directors and to Matt at the Haldeman Norfolk Housing Corporation for their review and for their consultation with their legal counsel. And I know that the Norfolk County Clerk has been canvassing staff around availability for a shareholders meeting sometime in September, and we'll work with staff at Haldeman County and the Haldeman County Clerk to confirm a date, a time, and a location. So we are looking forward to reconvening a meeting of the joint shareholders in September and having a shareholders agreement to present for adoption, based on the principles that, the guiding principles that were approved by the shareholders last fall. I'd be happy to answer any questions on that update before we go to the presentation, Mr. Chair, if you'd like.
Okay, thanks, Heidi. Are there any questions to Heidi? Councillor Corbett?
Thank you very much. I know Kathy Case is on virtual here, and I know the last information I had from Haldeman was that they had this with their lawyer. I would like an update of that. And Heidi, you must realize this has been with the Housing Authority for some time. Since I've been involved, I think it's almost 4 years that they've had it in place. Yeah, I'm anxious to see it get going so we can move forward. And I'm hoping that we can come to some fruition with the next meeting we're having to get it moving, because we're losing time. But I understand the problem we're through with COVID right now. It's costing us time and probably a lot of people's time involved with it as well. So I wonder if I can ask Kathy to update us on it if she's on virtual.
Yes, I am here. Can everyone hear me?
Yes, we can, Kathy. Go ahead.
Okay. As Heidi mentioned, senior staff here at Haldeman County have reviewed the shareholder agreement draft, and it has just recently been sent to our solicitor for his review, and I expect that it will be back by the end of July. and then it will be forwarded to the Housing Corporation for their review. Shortly after that, any suggested changes will be discussed between all three parties, and then will be presented in September at the joint shareholders meeting for approval. But basically what I can tell you, I think Heidi alluded to this, is that the principle, we met early on in the process to develop principles that we wanted to see included, all three parties to see included into the agreement. And as far as my review goes, I can see that all of those have been included, so I don't foresee major changes to the document after a legal review from Haldeman's side, other than if some questions on basic authorities that are related specifically to social housing or community housing versus affordable housing projects that Haldeman would do on their own. So those are the only questions, and once we get the review back, we'll have more information for everyone.
So we're moving ahead of it, and it's on the agenda upcoming in the very near future?
It's September and will be on the agenda for the joint shareholder meeting with both councils. That's the meeting that both councils will have an opportunity to comment and approve it.
Thanks.
So Heidi, is it your intention now that we're going to go to Matt for discussion?
So, Mr. Chair, if Matt has any comments that he'd like to make specifically on the issue of the shareholder agreement, I would invite him to do that. Otherwise, we'll turn to the presentation on social housing regeneration.
Okay, before you go to the presentation, just have one quick question for you. I remember back in 2001 when the region was dissolved and we were presented with the list of all the mortgages that we had on social housing. If my memory's correct, it was exclusively to social housing, right? Where do we stand on that today in terms of those mortgages? Where are we?
So, Mr. Chair, that's a really good question, and it's completely connected to the discussion that we're going to have on regeneration. So, in this traditional social housing system, or what we call the legacy social housing, so the buildings that were transferred from the province to the municipalities in 2001, they have an operating agreement with the municipality that is tied to their mortgage. So once the mortgage is paid, then they are free to renegotiate their involvement in this as a social housing provider, and that's where we talk about things like leveraging assets, where, you know, would we want to remortgage the property to do something different? Would we want to sell the property to do something different? Or is it a property that we don't feel is useful any longer to our system, and we would let it go to the private market, but we would redevelop something else somewhere else in order to maintain our service level standards? So that's the process of end of operating agreement and leveraging assets. We do have some social housing buildings within the HNHC portfolio, but also within our private nonprofits where their mortgages are either already paid off or they are coming up to that period of time within the next 3 to 5 years.
Okay. Is it possible, without going to a lot of work, is it possible to get a list of which buildings have mortgages on them?
Yes, Mr. Chair, we have a spreadsheet that we maintain so that we can keep on top of that. So certainly that is something that we can share with members of the committee.
Okay, thank you. Okay, I see no other hands, so I'll turn it over.
Is your mic now? Okay.
Thank you, Mr. Chairman. Members of the committee. Heidi, am I starting off in the presentation, or? Oh, okay. No, with respect to the shareholder agreement, I think, you know, we identify some of the challenges that we have had moving, you know, forward with the document, but, you know, meeting with Marlene and Heidi and Kathy yesterday, you know, we feel like it's moving in the right direction, so we hope to have that resolve and an agreement in place, because the document is a real critical component in terms of how Haldeman Norfolk Housing Corporation can act in the future.
Thank you, thank you. So Heidi, I'll turn it over to you and to Matt, and you can go ahead and,
Great, thank you. Thank you, Mr. Chair. So Matt and I are going to walk through the presentation deck that we've provided to you. I will acknowledge up front that the deck that you have is more text-heavy than I usually present, but that was done on purpose so that you have this as a reference document moving forward, because the concepts that we're talking about, some of the language and terms that we use can sometimes be used interchangeably, and there are some sometimes slight or not so slight differences between the terms. So the purpose of today is to really provide you with information about social housing regeneration and asset management, to outline the roles of county staff and councils, the service manager, and the housing provider when considering regeneration projects, to provide the Housing Corporation with an opportunity to talk with advisory committee about some of their goals for social housing regeneration, and to answer any of your questions. Today specifically, we are talking about the Haldimand Norfolk Housing Corporation, but I want to be very clear that social housing regeneration is a concept that applies to our entire system of housing. So it applies to our local housing corporation, the HNHC, but it also applies to all of our private nonprofit social housing providers within the system. And we have 10 of them throughout Haldimand and Norfolk. So for those of you who have heard me present before, I like to start talking, I usually like to start my presentations by defining key terms, so that when we use the language, I think language is very important, and that we're all on the same page about what we're talking about. So social housing is the first one. We sometimes refer to this as rent geared to income, or RGI housing, or the legacy social housing. So this is the housing that we just talked about that was transferred to the municipalities from the province in 2001. It's housing that was built, some of it up to 50 years ago, with federal and provincial funds, and it's administered by the municipalities through our department as the Consolidated Municipal Services Manager. Social housing is the housing that people apply to using the common application. They are on one centralized wait list. Their rent is calculated based on their income, and there are specific rules that they have to follow over and above the regular landlord-tenant rules, like the number of bedrooms that you're eligible for and reporting your income annually, those sorts of things. Social housing also receives an annual operating grant from the municipality. It is funded by the municipal tax levy in the municipality in which the housing is physically located. So Haldimand County levy dollars go to fund housing that's physically located in Haldimand. Norfolk County levy goes to housing that is physically located in Norfolk. Affordable housing. So affordable housing is housing that is offered in the private, either for-profit or not-for-profit sectors. And the tenants are chosen by the landlord, and they follow the regular landlord-tenant rules. They're not subject to the extra legislation, the Housing Services Act, that RGI housing is subject to. The difference between affordable housing and market rent is that the rents are set at 80% of the average market rent for the service manager area. Affordable housing may receive federal, provincial, and/or municipal funding during construction, but it generally does not receive operating funding. And there's no mandate. So in social housing, municipalities are mandated by the province to provide an annual operating subsidy that's calculated using a provincial calculation. Affordable housing, that's not the case. Generally, public funds are used to develop affordable housing in order to make it possible for the developer to provide or offer affordable rents, but it's not required. So going on to the next page, community housing. So community housing is a newer term, that has been developed by the Ministry of Municipal Affairs and Housing to refer to both traditional social housing and affordable housing together. So it's more of a generic term. So it means any rental housing that has received in the past or that currently receives public funds to be built and or operated. And finally, market rent housing. So this is the rental housing that where the rent is set by the landlord in accordance with the Residential Tenancies Act, and it's really based on what the market can bear. Sometimes market rent units are part of a community housing building, but market rent housing, when we think about rental housing that's available online or for rent signs or that sort of thing in the newspaper, generally that's how we think about market housing. So some key terms in relation to regeneration. First, when we talk about social housing regeneration, we're talking about the process of examining what we currently have versus what we need. So, as I said, some of our social housing was built up to 50 years ago. It may not meet, it might have met the community need at the time, but it might not meet the community need now. So for example, we have some social housing units that have 4 and 5 bedrooms. Our trend that we're seeing on our social housing wait list is that we have more single individuals and childless couples or smaller families. So we actually need more 1 and 2 bedroom units, not to say we don't need any 4 and 5s, but there has been that shift. So a regeneration process is looking at what do we have, how does it match what we need, and how do we get from what we have to what we need. It could involve, and it's about making our social housing stock sustainable. So some examples of regeneration projects can be undertaking repairs or redevelopment of existing stock. It could be demolishing existing stock and replacing it with an intensification project on the same land. So it could involve, parceling some lands together that have townhouses on it, demolishing the townhouses and replacing it with an apartment building, for example. It could involve also selling property and using the money to build something brand new. So asset management is the process of identifying and monitoring the value of our housing stock as a capital asset. It also involves capital planning to ensure that our housing stock is maintained in a good state of repair and that future capital costs are anticipated and appropriately forecasted in a capital budget. So the next key term is that we hear often is the term leveraging assets. And we talked about that a little bit when I answered a previous question. But this is a term that's commonly used in discussions related to social housing regeneration. So leveraging assets involves pulling the equity out of the current housing stock in order to undertake regeneration projects. So as I said, that could involve remortgaging properties that no longer have a mortgage, or it could involve selling properties and using those funds to rebuild something new.
Heidi, do you want questions as we go along here?
I'd be happy to take questions as we go along, sure.
Okay, Council.
Thank you, and through you, just regarding affordable housing with that 80% of the market rent calculation, is that something we run or is that something the province runs?
Thank you, Mr. Chair. Through to Councillor Taylor. Every year, the province provides us with our average market rent for the area based on data that the Canada Mortgage and Housing Corporation, they monitor the rental market, and so they give us what our average market rent is for the area, and they give us the 80% calculation.
Okay, and then is Haldimand Norfolk one area, or is it Haldimand and Norfolk separate?
Mr. Chair, through you to Councillor Taylor, they consider it one service manager area, so we get one rent level across Haldimand and Norfolk.
Okay, and just curious, what is the average rent right now? If you've got that, or send a memo out later is totally fine.
The one, Mr. Chair, through you to Councillor Taylor, the one that I can give you off the top of my head, because it's one that we use a lot, and it is an estimate. I'll send out the chart that shows, because it's based on per bedroom size, but the one-bedroom, the 80% of the average market rent is right around the 620, 625 mark.
Thank you.
And that generally does not include utilities.
Okay, thank you.
I would just say that in Haldeman, that rate has to be climbing dramatically based on all the development that we're seeing and that we are going to see going forward.
Mr. Chair, we've seen, in the 7 years that I've been doing this work in Haldeman, Norfolk, we've seen significant increases in the market rents, and therefore the affordable level of rent as well.
Great. Councillor Corbett.
Yeah, several questions come to mind when we speak of what actually affordable housing is, and it means so much to so many people. Affordable housing to a young couple who are working is an opportunity to get a decent rent. And I don't know whether that falls under the social housing aspect of it, or that falls under the market value of it. And when it comes to regeneration, RGIs, you have to replace one for one if you do a regeneration on them?
So, Mr. Chair, through you to Councillor Corbett, the first question around affordability. When we work with people, we see that we talk about depth of affordability. So even, so for example, for our recipients of social assistance, for many of them, 80% of market rent is not affordable. It's outside of their range of affordability. So that it is the province, for the purpose of funding of the development of affordable housing, defines affordable as 80% of the average market rent. But when we're working with people on finding affordable, sustainable housing, sometimes even that 80% is too high, and so it might actually be better for them to be in a market rent unit, but we give them a housing allowance from one of our other programs in order to make that more affordable. So we have a number of different programs in our department that are funded by the province that we can draw on in order to help increase affordability for people. And then your question about the service level standards, when we talk about consent for regeneration projects, when we, and I've had some conversations recently with ministry staff because to let them know that this is a big topic of discussion in our area right now. They have confirmed that one of the things that they look for when we report consent decisions to them is that we're maintaining our service level standards. But the legislation has changed recently around making requests to redefine what applies to the service level standards. So it doesn't have to be traditional rent geared to income units. It could be, as long as they meet the affordability criteria, there is an option for us to apply to the ministry to, if we're creating new affordable units, even if it's, slightly below the 80% average, we can ask the ministry to apply those to our service level standards instead of the traditional rent geared to income, because there is a recognition by the province, and some of the technical tables that I've sat on, we've shared with the province that traditional RGI system it's a legacy system that is cumbersome and doesn't work for everybody. So we don't have to get down to that 30% of your income that deep, like that depth of affordability in order for it to be affordable. So there is an opportunity for us to work with the ministry around how we meet our service level standards.
Thank you. Knowing what we know now and applying it to Grandview Lodge, could we have got more units off that property than what we did at 14, relying on the federal funding by getting some market value units in there?
So through you, Mr. Chair, to Councillor Corbett, we're talking about the Aspen Apartments development that is on the property at Grandview Lodge. according to the planning process, that property would fit more than 14 units. And my understanding is that there's still land available that we could at some point look at a second phase. I can't remember, Councillor Corbett, if it was 18, 20, 21, it was something around that there could, would be the max units on that parcel. The way that the federal and provincial funding worked at the time, we only had enough of that funding available to fund 14. So that's why the decision was to go ahead with 14.
Is CMHC recommending units be built with market value rentals?
Through you, Mr. Chair, to Councillor Corbett, I think that certainly we're not prohibited from doing that. And it would be my recommendation that mixed rent communities are a good idea to look at for a few reasons. One, the increased rent from the market rents helps to fund the subsidized rent. It allows us to have a variety of affordability levels within one housing community. The other thing is that I am generally an advocate of diverse neighborhoods and diverse housing communities, as opposed to the traditional, 2 blocks of social housing on one street where everyone in the community, there's a stigma that comes with that for the people that live there. And so when we have mixed, diverse neighborhoods, everyone has the opportunity to access the same kind of housing, regardless of what their income is.
And one last question for you. Explain the waiting list. A lot of people don't realize that anybody from Ontario can be put on the waiting list for our municipality. And are we supplying, based on that, just our local people, or anybody across the province can come in? I think that in my mind, is some difficulty for people who've lived in your community for some time, and they've contributed, and when it comes to get into these units, it's difficulty because somebody from outside can be spirited in. And your comment too bodes well with regard to our statistics would indicate that 1 or 2 bedrooms are better to be built. I think most of our waiting list deals with single seniors and adults that could use these units if we want to address that market. Thank you.
So, Mr. Chair, through to Councillor Corbett, the Housing Services Act is the provincial legislation that outlines how a municipal service manager needs to manage the central waitlist for the traditional legacy social housing, so the rent geared to income housing. The provincial regulations state that one of the eligibility that anyone in Ontario can apply to social housing anywhere in Ontario. So I, as a resident of Norfolk County, can apply to social housing anywhere in Ontario, and as long as I meet the eligibility criteria in terms of income and assets, I am allowed to be on the wait list based on the date that I apply. We are not permitted to have a priority category for local residency. So the only priority category that we have in Haldimand, Norfolk is for survivors of domestic violence. So it is true that people living outside of Haldimand and Norfolk are eligible to be on the Haldimand, Norfolk wait list, just as it is true that people from Haldimand, Norfolk can apply and be on wait lists in other communities.
If I may, do you know what that percentage is?
Mr. Chair, through you to Councillor Corbett, I do not know. I can run a report on that, and I would be guessing. I don't think it's a large percent, but that I don't want to guess on that.
Thank you very much.
Okay. So we've talked about why social housing regeneration is important to consider, and it really is about making sure that we have a stock that meets the community needs, and that we have stock that is in a state of good repair and that provides a value to the community. So I just wanted to go over a little bit about the approval process, how we see it working for regeneration projects to come before council. This isn't meant to be an onerous or cumbersome process, and our office, myself and the team that I work with, we really encourage housing providers to bring us into the conversations at the beginning so that we can work collaboratively through this process with a housing provider. So we ask that the housing provider submits a business case. It's really my role to ensure that the business case meets the compliance of the Housing Services Act, and that I do a cost, benefit, and risk analysis for the municipality. I engage with senior staff in the applicable municipality, so Haldimand County for Haldimand projects. Kathy Case is my first point of contact, and with senior staff here in Norfolk. And then I would write a staff report for the municipality and present that for their consideration with a recommendation whether or not I think it's a good idea to move forward. And then we do have to have this, we're going to talk about service manager consent in a moment, but there is a legislative requirement that Norfolk County, as the legislated consolidated municipal service manager, would give the final sign-off so that the ministry, that meets the ministry requirements. So around the issue of service manager consent, this has been a shift. Previously, everything had to go to the province for ministerial consent. Now a number of things have come to the local service managers, which is really a benefit because it means we get to make the decisions locally based on our community needs. We do have to make sure that, so some examples where service manager consent applies include transfer of social housing properties, sale of property, or remortgaging of properties. The Act says that we must ensure that any proceeds of sale of properties are reinvested into community housing programs, that there's a tenant engagement plan in place as well to ensure that any tenants that are impacted are able to be rehoused and that we're not inadvertently creating homelessness as a result of a regeneration project. That we do maintain our service level standards, and as I said, there's ability to negotiate what that means with the province. And then all service manager consent decisions must be reported and reviewed by the ministry. And I would advise that the legislation does say that if the ministry finds in their review that we have not done our due diligence in, and that if we've made a decision that doesn't meet the requirements of the legislation, that we do risk, in a worst case scenario, the ministry removing our ability to make service manager consent. I am not at all concerned that we would ever get into that situation in Haldimand and Norfolk counties, but just to be aware that that is part of the legislation. And I'd be happy to answer any questions, any additional questions, and then I'll turn it over to Matt to talk about some of the goals of the Housing Corporation for regeneration.
Heidi, the waiting list that you speak of at the advisory committee, I know you used to give us a statistical report. That's not just people in Haldimand and Norfolk, or is that people just in Haldimand and Norfolk?
So, Mr. Chair, that is the centralized waiting list for the Haldimand Norfolk social housing stock. There may be people on that wait list who are not currently residents of Haldimand and Norfolk.
Okay. I've asked our planners this at Haldimand, but I'll ask you this as well. In any of the discussions that you've had with ministry staff or the meetings that you've attended, has there been any thought given, or do you see the province taking any direction towards forcing developers that come into communities and build these mega projects to include a component of social housing in their project and work with the municipality, to make that happen? Is there any discussion whatsoever? And I say that because of the track record from the federal government and the provincial government in terms of providing substantial capital dollars to create new social housing in our municipalities. It hasn't happened. It hasn't. I think the Dunville project was a great project, but you know, it was a small dent in the waiting list, and we've yet to see substantial dollars come forward from the federal, provincial level to do that. Has there been any discussion of the province about moving in that direction and creating, you know, creating a well-rounded residential development project instead of it being what we're seeing today?
So, Mr. Chair, I know that there have been a number of discussions provincially, and we have, through our office, we have regular discussions with private developers around encouraging, how can we encourage the private development community, how can we incentivize them, how can we promote the benefits of including affordable housing in a larger private development. We set, through official plans, we set targets for affordable housing development in private developments. But I think that there, overall, the thought is still that it is a better approach to engage, encourage, and incentivize than to require. So that's the approach that we take, and I believe through setting targets in the official plans that's the approach that you know, locally we have taken as well, and I'm not aware that the province is looking at making requirements for developers.
I guess the Ontario Builders Coalition then has a stronger lobby.
Yes, please. Thank you, Mr. Chairman. Through to the committee, I can sort of elaborate on what Heidi has said, that it's not required or mandated, but I can tell you that municipalities across this province are doing exactly that public-private partnership. We can turn to Hamilton most recently, and I shared that RFP yesterday with Kathy, but it was a request for information that went out to the community, really to look at what that private-public partnership could be. And that has been awarded. They're still negotiating the contract, but you're seeing a significant development with Mars Homes, City Housing Hamilton, and Indwell on a 3+ acre property, a waterfront property at Pier 4 in Hamilton. So it certainly is, and when we look at CMHC and we look at funding applications, you mentioned funding, so through the National Housing Strategy, there's several funds through renewal and repair funds. The criteria that they use look specifically at the number of partnerships, the deep affordability of housing, the accessibility, the energy standards, and I'm going to talk about that a little bit in our presentation, but certainly more funding's available when you start to tick all those boxes, and you can really show and demonstrate those private-public partnerships.
Thanks, Matt. I forgot about the National Housing Strategy. I forgot about that, but you know, over the years, though, I just have to wonder out loud, though, would it be more efficient to force the developers through the Planning Act to incorporate a component of social housing in their project? Because land is becoming scarce, and these are supposed to be well-rounded communities. You know, where we're seeing the development, land for development in the GTA is becoming scarce, and that's why we're seeing what we're seeing in Haldimand County right now, and areas of Niagara. And yet you have to wonder whether, you know, you're listening to the poverty action groups across the province, you know, whether they're being heard. But that's just my personal opinion. But I wonder what discussion, so I'm encouraged at least to hear that there is some discussion at the province about it.
Thank you. Looking for Haldimand initiatives, Norfolk waives the municipal fees and development charges. Is this universal across the province for that type of thing?
Mr. Chair, through you to Councillor Corbett, there are abilities through the Planning Act for municipalities to provide some additional encouragement or benefits to developers of affordable housing. Waiving development charges is one of those. and, or planning fees, you know, that sort of things. So that's a choice that a municipality can make.
Okay, I see no other hands, so we'll go to Matt for your presentation.
Great, thank you, Mr. Chairman. Through you to members of the committee. I thought it might be helpful to start out by highlighting briefly a little bit of information about HNHC and its role as a member of one of Ontario's standalone housing corporations. You might not know it, but Haldeman Norfolk Housing Corporation is one of 10 local housing corporations across the province of Ontario, and we provide almost 50% of all of the social or community housing that's available in the province, and that looks like about just over 94,000 units. We have almost $15 billion in assets, and the average age of housing stock is 45 years. It's also important, I think, to note that local housing corporations have been helping communities across Ontario meet local housing needs through entrepreneurialism and business innovation. And then, although I'm here today as a spokesperson of HNHC, I meet regularly with the other 10 CEOs across the province, major municipalities like Hamilton, Ottawa, Toronto, Peterborough, Kingston, and London, and we share a lot of our resources. So that is a real benefit for both of these counties to have that asset in place. And like the service managers across the province have an advisory board with the Housing Services Corporation, the local housing corporation CEOs meet as well. And we share all of the resources and the lessons learned across the province. So whether it's the best practices on regeneration, whether it's requests for proposals or requests for information, we're constantly sharing all of those best practices and utilizing the lessons learned. Specifically about Haldeman Norfolk Housing Corporation, just a quick little refresher. We've been operating in the Haldeman Norfolk community for 45 years, very successfully. There's a super talented team back at HNHC that are extremely committed and caring and really love the work that they do. Heidi mentioned a little bit about the housing system here in Haldeman Norfolk. I think it's important to note that HNHC actually represents 2/3 or 66% of that entire system. So when we look at the available housing stock across both counties, Haldeman Norfolk is managing and owning 544 units. There's 214 in Haldeman, and there's 330 in Norfolk County. And our assets, or I should say your assets, hold an estimated value of over $80 million. And most of the mortgages are paid off at Haldeman Norfolk Housing Corporation. So that's all unencumbered, mostly debenture-free. So we're in a real good spot to talk about leveraging those assets, and we will a little bit down the road. And we're governed by the shareholder agreement that will soon be in place. But at this point in time, it's a 60-40 split, 60% in Norfolk and 40%. And I think what's important to note about that is we're unique. So I don't really see us as just one of those other housing providers. This corporation is owned by both counties, so all of the assets and any of the municipal or federal investment that's made into this corporation stays within the corporation. And the shareholders have care and control of those assets. So that's significant when we talk about down the road and what happens to these assets and the equity in these assets. Some of the goals at HNHC, we have two of our board members here today. On the Norfolk side, Councillor Ian Rabbits, and on the Haldeman side, Councillor Bernie Corbett. And this year, it's been one full year for me at Haldeman Norfolk Housing Corporation. I like to think of it as a transformative year. We've done a lot of work, specifically rolling out our 7-year strategic and business plan, which was rolled out this year in collaboration with the service manager and both CAOs. And some of the key strategic priorities that we've highlighted is, mainly is regeneration, but, our ability to maintain financial fitness and economic sustainability, looking at frameworks, accountability frameworks like performance measurement and result-based accountability, so that when we're bringing information to council, to our shareholder, to our board, it's backed with facts and data and evidence. So if you'd like a copy of our strategic plan, we have it. We have a new website that we built in collaboration with the service manager. We can send that out to anybody. And we have a real interactive website as well, and that really leads into the resident engagement side of what we're trying to do. Really repair and rebuild that relationship with our residents. As Heidi mentioned, resident engagement, and that communication planning that needs to happen through regeneration process is critical, and we want our residents to be on side and be informed and be able to inform what new communities could look like and consult with us about the things that they want to see in their communities. With respect to the regeneration, it's a big term, and there's a lot of technical documents that sort of go into getting us there to present a master regeneration plan. And some of the things that we're working on to get there are updating our building conditioning assessments, making sure that our energy audits are up to date, and then utilizing the funding that was provided through council to Haldimand Norfolk Housing Corporation to roll out and present that real robust asset management strategy. And together, we'll start to see what those regeneration goals are. And they sort of look like this, and we're currently undertaking a complete review of all HNHC's assets, its programs, its communities, its stakeholders, and its organization. We'll create a strategic plan for existing assets, which highlights provincial requirements and the asset classification process. So Heidi talked a little bit about that, but what that looks like is including scenarios for regeneration, which, when decisioned, will yield a plan for asset growth, which is housing capacity, and looking at including modernization. That's not just happening at HNHC, but that's happening across the sector. So through this process, we'll look at the processes, we'll look at what we can lean out and what meets those provincial requirements. We'll create a plan that's optimized for outcomes and required investment in terms of loan and equity. And really what we're talking about there is financial modeling. And we'll want to identify outcomes for the number of new and additional units of affordability. We talked a little bit about that, but deep subsidy, deep affordability, affordable housing units, equity and loan requirements, and service levels. And I think what's important, Heidi talked and mentioned a little bit about the service level standards, but I do want to be upfront with the committee. It's almost virtually impossible to maintain service level standards when you're going through regeneration, because we're talking about taking units offline to build new units. But what we've seen in other municipalities is the ability to communicate with the ministry around what a comprehensive plan would look like, so that when we cross the finish line, not only are we meeting those service level targets, but we're actually exceeding with net new affordable housing. And that's really what they like to see. So that's one of the areas that we're going to pay particular focus in our planning. With our regeneration plan, we've woven the asset or strategic asset management plan in. That's going to allow us to maximize shareholder value. And it's going to allow us to optimize and leverage existing equity. And really what we're talking about there is the sale of our singles and semis. And by doing that, we can create strong mixed use, mixed income communities, and the creation of financially self-sustaining housing. And that's really the big shift from moving from traditional legacy social housing, as Heidi so graciously explained, to moving into those mixed use, having different levels of affordability, different levels of people living within those buildings, so that we can create what we like to call net operating incomes, a bunch of different revenue streams that make that building or make that property more self-sufficient. We want to improve the environmental stewardship. There's a lot of different ways that we build housing now. There's a lot of different standards, but we want to exceed our current energy and greenhouse gas emission targets based on a life cycle approach to building housing. And then, of course, we want to facilitate strong strategic partnerships with community members. We're not funded for different levels of support, although it's very clear across the province that people who live in community housing require additional supports. And although we're not funded for that, our approach will be to bring partners online. So if we're building a seniors building, for instance, we want to work with Community Living or NACO and ensure that the folks that are living in these buildings have the appropriate supports. So next steps, we're working hard right now with our consultant to finalize our energy audits and our data sets that include our building conditioning assessments. And we want to work through the asset clarification analysis piece. And this is really important. Heidi talked a little bit about this, but this is a process of multivariate modeling based on indicative factors to classify assets into categories. So we want to look at, do we retain these assets? Do we revitalize these assets? Do we redevelop these assets? Or do we dispose the assets because they're no longer at a good use of life? And through that process, we'll select assets to redevelop or revitalize. And we're working right now with both counties to secure potential land sites for new development. And we'll continue to work closely with the service manager to prepare the business case that's required to take to the ministry so that we can come to council in the fall with shovel-ready projects for both Haldimand and Norfolk County. And of course, we want to continue to work with CMHC. We have a great rep in Kathy who I'm meeting with regularly. Heidi's looped in and meeting with our development team as well. We want to maximize not only the equity and leverage the assets that we have, but maximize the funding opportunities through the National Housing Strategy, as well as additional funding sources in the community. That's it.
Thanks, Matt. Is the application process for the National Housing funding, has that gotten any easier? Because I've heard a lot of comments about how cumbersome it can be.
Yes, through you, Mr. Chairman. I want to say that the province recognizes some of the challenges that's happened, and they've deliberately made some changes to how we can apply for funding. And again, going back to our role as an LHC, municipalities like Windsor-Essex, Hamilton, Ottawa, Toronto have already done redevelopment. So we have their applications, we have those resources, and basically what we're doing is utilizing those tools so we don't have to reinvent the wheel and bring the pieces on board to move that ahead. But I can tell you that we're working extremely close with CMHC. We have put forth our intention to a portfolio submission for a master regeneration plan, and we're looking, this is aggressive, but we're looking at 5 developments over the next 15 years, 2 in Haldimand, 3 in Norfolk. That will require regular meetings with them. It will require different levels of contribution from the municipality. So we not only are we working with CMHC, but through Heidi, working with both general managers and senior leadership teams to look at how we can minimize the potential financial contributions. And a great way to do that is, through paid development costs. It's through, land transfers or gifted lands through the county, because the National Housing Strategy will look at those contributions in a dollar amount. So municipalities don't necessarily have to give money. If they're giving assets, that's translated into dollars, which can be utilized as well.
Okay, thank you. Are there any questions, Councillor Corbett?
Yeah, thank you very much. I'm very excited about the opportunity for regeneration, but I don't want to go into it with a halo effect, nor do I want to go in it with blinders. And I have to revisit something. I have a question on that, then a question on regeneration. With regard to the Aspen Apartments in Dunnville, would that have been better to have an asset within our corporation? And I must admit, I thank Heidi for getting that opportunity there to have it as our asset, whereas we paid out $250,000 and we backed the loan. Would it have been better to retain it for ourselves? I know that might be a loaded question and it's revisiting it, but I was part of the decision, so I just want to know, was it a good decision or?
Are you asking me, Councillor Corbett?
Yes,
So
from your background.
So through my perspective as, somebody who's worked in social housing for the last 20 years, this is the second local housing corporation that I've worked for. I might be a bit biased. I believe personally that an asset that remains within the county is a benefit. At the end of the day, again, when the county owns the asset, they have care and control of that asset. And there are great nonprofit housing providers out there that would probably, and that do work out the life cycle agreement of that funding. But I personally believe that by having care and control of that asset, we're in a better position.
And we've invested a forgivable loan of $250,000 that we could have utilized elsewhere. Thank you.
Mr. Chair, could I just offer some comments as well? Certainly I appreciate that question, Councillor Corbett, and I know that at the time that we were having discussions between our office and Haldimand County about the fact that Haldimand County generously was making this land available for affordable housing development, that Haldimand County staff and our staff worked through, a bunch of different scenarios, and I think I'm confident that the best advice was was provided to council, and I remember that there was a lot of discussion at Haldimand County about this project. And at the end of the day, the decision was made to allow a nonprofit developer to have access to the land in order to respond to an RFP for federal and provincial funding for affordable housing development. And that developer went through the public procurement process and was the successful applicant for that funding. So I don't know if Kathy, I know Kathy's on the line, if she has anything else that she wanted to add, but I just wanted to offer that it's my remembering of the situation that staff worked with council through a number of different scenarios and provided our very best advice on that project.
I'll let Kathy answer, but I was very happy that it went through. I don't want it to be construed as criticism. I'm looking at, could we have done something else that would have benefited by it?
Kathy, do you want to comment?
Sure, I'm not much. Apologies, but I wasn't directed to the project team of the onset of the different. I do know.
Maybe we can come back to that. On my second question, it has to do with the best practices, the reference that we've been given from Windsor-Essex Community Housing Corporation, who went through this practice of regeneration, and some things hit me quite easy. Deteriorating legacy housing and stock, unfounded capital liability, rapidly increasing operating expenses and subsidy requirements, flat annual revenue changes, mismatched housing supply, as we've been informed by Heidi, you got 5 units and our demand is for 1 or 2, 5 bedrooms, I should say. And there's still that stigmatization out there. My question is, we are a financial conservative community, and taking our capital assets and leveraging, we have to be sure that we're doing something that is responsible for the citizens. Have you a financial plan going ahead where we can capitalize on our assets and address some of these concerns that are outlined in the report that they present?
Through you, Mr. Chairman, to you, Councillor Corbett. Yeah, part of the process will be the financial modeling. So, in Dunnville alone, there's $10 million in assets. So what we would want to do is look at, for instance, the supply and demand data or the housing and homelessness data and make sure that in the new development, it's reflective of what is needed in that direct community. And once we look at all of those factors in the data sets and we determine the type of build that we want to look at, then we build the financial modeling to make sure that it's economically sustainable and viable. So that is a big part of the plan, and that's what we're working towards right now, building the business case so that we can present those numbers.
What is the process going forward if Norfolk approves regeneration, or is it parcel of the shareholders' agreement?
Through you, Mr. Chairman, back to Councillor Corbett. I could let maybe Heidi jump in on this a little bit, but I think, from our perspective, the regeneration planning is going to happen. The counties have funded the asset management strategy, and the corporation put together a regeneration plan a few years ago that was funded by the service manager. So we're using that plan, but recognizing that, we want to ensure very, very closely that what we build is built directly in the neighborhoods that the data reflects the need. So we are going to compile all of that information and then work with the service manager to present that information for formal approvals.
Thank you, Mr. Chair, and through you, I would just like to give assurance to Councillor Corbett and the other members of committee from Haldimand County and Haldimand County staff that when we are committed to ensuring that Haldimand County is leading the decision-making process on the properties that are physically located in Haldimand County, and that Haldimand County has been funding with municipal levy dollars. So that if we're considering regeneration projects for Haldimand County, yes, we do have this legislative requirement where the service manager has to give the final sign-off in order for us to report to the ministry, and the ministry to say that we are in compliance with the legislation. But it is not ever my intention that we would be looking at and considering regeneration projects in Haldimand County that Haldimand County staff and council did not approve and think were valuable for the community.
Councillor Patterson.
Just, I guess, a bit of a conceptual question, and maybe it's to Matt, I don't know. The regeneration, I get it, and Heidi spoke to it earlier about a lot of large homes that aren't really a requirement today. You want something smaller. I know in Haldimand there's quite a few houses that we're currently using that are at the end of their life. There's not been a lot of talk in Haldimand. I know it seems to be kind of a passion in Norfolk, this, I'll call it a tiny home or modular home type idea. Is there any thought, or is it possible, or is it pie in the sky because it's too expensive? A lot of people would probably not like to, if they had a choice, live in a large apartment building that they can hear, every noise from their neighbors. Is there any consideration to that as far as if there's like a joint type venture? I know listening to the previous meeting here in Norfolk, there was some individual from an area in Norfolk that wanted to partner with the county. Is that something that's even on the radar, or is that too far out in left field?
Through you, Mr. Chairman, to you, Councillor Patterson. I don't think that it's way out in left field. It's really is something that we would want to get clear direction from the county in terms of if that's something that the municipality wants to do, and then we would look closely at how we can incorporate that into the regeneration planning. I personally, I've looked at a lot of regeneration planning across the province, and tiny homes, modular homes certainly comes up. I know in Norfolk it's come up as well, but I haven't seen, any real robust planning that's been put into regeneration plans that include that. But I'm certainly, open. For me, it's about looking at what the municipality wants and building into the plan what it is that they want to see. So a lot of people are talking about it. Some of the challenges you have in rural communities with it is how do you bring service in individually? How do we do the sewer hookups? It gets quite cold here, so making sure that the units can withstand the seasons that we have here. But I don't think it's an unsurmountable effort. It's just one that I certainly don't have a ton of experience in, and I'm not seeing most major municipalities sort of work into their regeneration plan. But that doesn't mean that it can't happen. I think it solely depends on what the municipality wants, and that's where you have an opportunity to be unique. Our strategy is more around intensification. So with all of those single-family homes, larger homes, looking at intensifying an area so that build is economically viable down the road with mixed income sources. And that's sort of, what you see across the province as best practice.
Are we, what groups in the communities are you talking to right now, just to spread the information, communicate, get feedback, the poverty groups, the church groups, the Lions clubs? Are you talking to these groups right now, telling them where we're going, like either one of you, where we're going with this plan?
So, Mr. Chair, I can start, and then I can let Matt talk specifically about the work that he's been doing around the Housing Corporation regeneration projects. When we did our 5-year review of our 10-year housing and homelessness plan, we had a technical team, a technical committee that helped us through that process. Matt was part of that group, and representatives from all of our major community-based health and social services partners, places like our community living agencies, mental health and addiction support services, Haldeman Norfolk Women's Services, who works with survivors of domestic violence, Haldeman Norfolk Reach, who work with youth who experience housing instability and homelessness. And we also did community engagement specifically with people with lived and current living experience of housing instability and homelessness, and their voices really informed the update of our 10-year housing and homelessness plan. Moving forward, the plan was received positively by Council and Committee on Tuesday night and was approved previously by this committee. Once we have final approval, then our next step will be to convene an implementation team, and with many of the same partners, if not all of them, to help and support us moving forward to implement the strategic goals and objectives within our 10-year housing and homelessness plan.
Through you, Mr. Chairman,
Sorry, go ahead.
just to build on that, we use that same data set when we look at the development of new affordable housing, but I've been working more independently or strategically with some of the service providers, looking ahead at what types of developments we might do, as I mentioned earlier. So if it's a seniors building, I want to be working closely with Haldeman Community Living, for example, if it's in Haldeman, so that whether it's developmental services or senior services, we have those partnerships built in pre-development so we can service the residents that live there, so ultimately they can be more successful. But certainly working with other community providers here in Norfolk, I've meeting with and have support from Fanshawe College when we're looking at the development of affordable housing. How do we incorporate our students? How do we build that into the BIA through an economic development lens and build revenues as well and have access to those markets? So I'm working sort of at a broad level to build those partnerships, those strategic partnerships in both counties.
Okay, thank you. I have Councillor Taylor with a question.
Thank you, and through you. When we talk about the disposal of a property, I'm sure that's the sale of a property, is there some sort of mechanism where other housing providers get the first kick at it, or is that straight to market with the property?
Through you, Mr. Chairman, to you, Councillor Taylor. Really, we have the opportunity to kind of write the script. And I had this conversation yesterday. How do we keep affordability? How do we prevent, let's say, folks from moving from far away communities into these communities because maybe the housing market's more affordable? So I think in the way that we write the RFP, if councils or committee made a decision that, we want to have a home ownership program, and maybe we want residents to have the opportunity that live there to buy the home. The slate is really clean in terms of how we write that. So what I would say is we can be as creative as we want to be. Traditionally, the strategy has been to sell the asset because the market's high right now, retain those dollars, put that back into a new build, which again, minimizes the financial ask from council. That's been the strategy, but I've also seen home ownership programs. I think both counties have an opportunity to write those RFPs in a way that is reflective of what you want.
Thank you.
Councillor Rabbit?
Thank you, through you. I have less a question, but just more of a little bit of a comment. Since Matt's come on board with the Haldeman Norfolk Housing Corporation, I've seen a real revival and sense of energy in that corporation, a real drive to get a professional business plan before both county councils. And I'm just really supportive of the regeneration efforts to date. And there's been a lot of hard work to get this presentation put together, and the partnership that is formed and is continuing to blossom between our service manager and the Housing Corporation. I have to say I've seen a lot of progress made in a very short amount of time, and I find that very encouraging. So, my comments, really they're around how I can support regeneration and specifically the approval process. That's how I really see my role. Serving on the Haldeman Norfolk Housing Corporation alongside Councillor Corbett has also opened a window into the needs in Haldeman County and how us being the consolidated service manager for the whole health region, it's really opened my eyes to the needs for community housing, social housing, affordable housing, and the role that a a local housing corporation can play in being a pillar among other pillars that really provide enough support to hold up a house. And ultimately, at the end of the day, we're talking about putting roofs over people's heads that are disadvantaged in our communities. And regeneration is a really key component to getting more units online and disposing of those assets that, frankly, if they're not maintained, and we're fortunate that in our portfolio we have a really good record, but as a legacy housing provider, you know, some of these units are beyond their life cycle. It doesn't matter how much investment you put into it, there are going to be assets identified that we will need to dispose of, and there is going to be opportunities for regeneration. So it's really exciting to be having these conversations early, and you know, my intent and my support to get this presentation here today, with the help of Matt and his team and Heidi and her team, you know, we're starting to fire on all cylinders here, and everyone's on the same page. So when we come into our shareholders agreement, I wanted Haldimand County to feel that they've been engaged and that they're informed. We'll be hearing some of the same terminology used, and we'll be able to speak to it with some intelligence. And so I'm really looking forward to having regeneration as a bullet point or as a key objective in that shareholders agreement. And it is going to benefit both of our communities. At the end of the day, we have control over development in both of our counties. And when you have Haldimand councillors and Norfolk councillors working together, you end up getting a better outcome for Haldimand Norfolk in general. So, you know, those are my comments. I really want to help expedite the approval process so that when we are ready to have service manager consent, we have the business plan and a shovel-ready project, we're able to secure those upper levels of funding from the province and from those in the National Housing Strategy, those ministries where there is some dollars available for the types of housing development we're talking about, mixed use, and servicing a broader range of different individuals who have different needs in our community with regards to housing. So thank you for that opportunity to speak, Chair. I'll turn it back through you. And you know, really, if there's any comments that maybe came to mind, if Matt wanted to comment or Heidi had any response to those, you know, I'd really welcome that. Thank you.
Just to thank Councillor Rabbits for his comments and all of committee for their time this afternoon. As our next steps, Matt and I are continuing to work together to take the concepts, the regeneration. There is a project that the Housing Corporation has in mind for each county. So we're looking at those concept drawings and the initial high-level budgets and working on really refining them into a business case that I can provide some analysis and recommendation to councils on how to move forward, and our collective goal is to have that as part of the discussion at the shareholders meeting in September.
Okay, that's great. Thanks, Heidi, and thanks, Matt. Councillor Cora, one final question?
Yeah, I have to echo those comments that Ian made and yourself you made in terms of the presentations. Thank you very much. A question come to mind when Ian was speaking in terms of shovel ready, and I know the Premier has announced some affordable housing funding for COVID-19 or in this process. Is that lip service or is that money out there?
So, Mr. Chair, through you to Councillor Corbett, that funding is called the Social Services Relief Fund. So it's an extension of our Community Homelessness Prevention Fund. To date, Haldimand Norfolk has been allocated just over $2 million, and we have been using those funds. In the first phase, we needed to stay within the service categories of the Community Homelessness Prevention Initiative, so emergency housing, homeless prevention services, and supports. That's where we've been providing the community food program and additional support to people, vulnerable people with no supports in the community who are isolated due to COVID-19, to make sure that they have food and meals and the basic supplies that they need. You're correct, Councillor, that a second phase of that funding was recently announced. and we're expecting our planning allocation and the funding guidelines by the end of the month. So I don't know yet how much money is being allocated to our area. When I watched the announcement, Minister Clark referenced a capital component, and I have heard ministry staff reference a capital component as well. When the funding guidelines come out, I'll know better whether that is capital related to homelessness or whether permanent affordable housing also qualifies. I'm just not sure on the details of that yet, but I do know that, that we are able to submit a business case for some capital project.
Thank you, and that was my question on capital projects, if there was any money forthcoming for that. Thank you.
Okay, thanks very much for your presentation and for answering all our questions. Marlene, I don't see anything else listed on the agenda, so I'm going to move to adjournment unless you have something else you want to add.
Through the chair, I have nothing unless there's other agenda items from committee. Thank you.
Anything else from members of committee? And I have a motion then to adjourn. Moved by Councillor Taylor, seconded by Councillor Corbett. All those in favor? It is carried unanimously. Thank you.